Look inside your bathroom medicine cabinet right now. There is a very high chance you will find ordinary, everyday pills that are quietly damaging the most vital organ in your body. I am Dr. Eric Lawson.
Everything looks
For over
great,
20 years as a
particularly
cardiac
your
surgeon,
blood pressure.
I have stood in the operating room and treated patients whose hearts were failing.
Doctor.
But here is the truly heartbreaking reality. Many of these hearts were not destroyed by natural aging, poor diet, or bad genetics. They were damaged by common medications that my patients trusted completely. We are not talking about rare treatments or heavy prescription narcotics. I am talking about the simple pain reliever you took for your aching knees this morning, the stomach medicine you swallowed after breakfast, or the over-the-counter cold syrup you bought just last week. We often view these everyday remedies as harmless helpers. Yet, for adults over the age of 60, some of these common pills can act like hidden intruders, placing immense and unnatural stress on your cardiovascular system. Please understand that this video is strictly for educational purposes and is not meant to replace professional medical advice. My goal today is not to use fear to make you throw away your treatments. In fact, stopping any medication abruptly without medical supervision is extremely dangerous. Instead, my mission is to empower you with life-saving knowledge. Today, I will reveal 5 common medications that carry hidden heart risks for older adults. More importantly, I will equip you with the exact questions you must ask your physician during your next visit.
About 3 weeks
Stay with me, because understanding these hidden dangers might just be the most important step you take to add healthy years to your life.
A gradual
Let us begin
shift
with number
often
5
begins
on our
with a
list,
quiet
a
moment
group of
attention.
medications found in
Subtle
virtually
movement
every
develops
home.
when awareness
I am talking
expands
about
and breathing
non-steroidal
becomes steady.
anti-inflammatory
Balanced
drugs,
motion
commonly
forms a
known as
natural rhythm,
NSAIDs.
allowing each
You likely
phrase
know
and
them by
pause to
everyday
flow
names
without
like
tension or
ibuprofen,
hesitation.
naproxen, and
Progress
diclofenac.
rarely
They
appears
are the
as a sudden
usual go-to
transformation.
solution for headaches,
Instead,
back pain,
it builds
and
slowly
arthritis.
through
There is no
repetition and
denying they work
observation.
brilliantly for
Small
pain
adjustments
relief. But
influence
here is
the
the
overall
educational
direction
truth.
of movement,
Taking
creating
these pills
patterns that
regularly
become
after
more
the age of
stable
60,
with time.
especially if
When
you have
focus
underlying
remains
heart
calm,
concerns,
every
is like
action
playing
becomes
Russian
more
roulette
deliberate.
with your cardiovascular
The body
system.
settles into a
The
comfortable
medical community
posture,
has known
and
this for
speech
decades.
begins to flow with clarity.
Since 2005,
Words move forward
health
with a
authorities
balanced
demanded
pace,
clear warnings
allowing
about
each sound to
cardiovascular
form
risks
naturally.
on these medications.
Soft consonants blend
Yet,
with rounded
millions
vowels.
still take them daily,
Brief pauses
completely
allow the
unaware
rhythm
of the
to
hidden
reset
strain on their
before
bodies.
continuing again.
Allow me to
The
share the
motion of the
story
lips,
of Michael.
the shift of the
Michael
jaw,
was
and the
72
expansion
years
of
old
breath
and
combine
loved
to
working
create
in
a
his garden.
continuous pattern of
To
articulation.
manage knee arthritis,
Sometimes
he took
the
an
pace
over-the-counter
becomes slightly
pain pill
faster.
almost every day.
At other times,
he
the
thought
rhythm
he was doing the
slows.
right thing.
This variation
One
keeps
afternoon,
movement
while
flexible
tending
and
his
prevents
roses,
stiffness.
he felt completely
Balanced
drained.
motion often
He could
produces
not catch
smoother
his breath,
expression.
and his ankles had
Observation
swollen to twice
improves
their normal
awareness.
size. At
Awareness
the emergency
improves
room,
control.
we discovered he was
When each
experiencing
moment
acute heart
receives
failure.
attention,
From an
small
educational
improvements
perspective,
accumulate
we must
naturally.
understand the mechanism.
Pressure often
How can a
fades when
common pain
patience
pill
grows.
cause such a crisis?
Instead of forcing
While
progress,
NSAIDs block
a steady
enzymes that
approach
cause
allows
joint
each phase to
inflammation,
develop on
they
its
also
own.
interfere with
Gradual
substances
expansion
protecting your
often
kidneys and
produces
blood
stronger
vessels.
results than
This
sudden
triggers
change.
two dangerous effects.
Breathing plays an
First,
important
these
role
drugs
in
force
maintaining
your body
rhythm.
to retain
A
salt
slow
and water.
inhale expands
Imagine
the
your
chest,
heart as a pump,
while a measured
and your blood
exhale
vessels as
supports
pipes.
controlled speech.
If you suddenly
The balance
force
between
massive
breath
amounts
and
of
voice
extra fluid
helps
into those
maintain
pipes,
consistent
the
pacing.
pump has to
Clear
work at maximum
articulation
capacity.
improves understanding.
An older heart,
Rounded
perhaps
vowels open
already
the mouth,
dealing with
while
mild
sharper
hypertension like
consonants
Michael's,
briefly close
can
the
simply
lips before
fail under
releasing
this
sound
immense
again.
pressure.
This
Second,
continuous pattern
these
forms the
medications
foundation of
actively
spoken
constrict
rhythm.
your blood vessels,
Movement
driving
remains
your blood
smooth
pressure up.
when tension is
If
reduced.
you take prescribed
Relaxed
medication
posture
to control
supports
blood
natural
pressure,
flow. When the
regular
body
use of
remains
NSAIDs
balanced,
can cancel out
speech
their
follows
positive
with greater
effects.
stability.
They can even neutralize the
Variation prevents
heart-protecting
repetition
benefits
from
of your
becoming
daily
rigid.
low-dose aspirin.
Slight
The
differences
solution
in
is not to
tone,
suffer through your
emphasis,
pain,
and
but to
pace
take educated
create a more
action.
natural sequence
You
of
must
sound.
have an honest conversation
Even
with
small
your physician.
adjustments can change
Ask
the
about
overall
safer
feeling of
alternatives
movement.
for your specific
Confidence
health profile.
often develops
Sometimes,
gradually.
a different pain
With
reliever like
repetition,
acetaminophen is
actions
sufficient.
become familiar
Other times,
and easier
topical
to
creams that
perform.
work locally are
Over
excellent
time,
choices.
effort
If
decreases,
an anti-inflammatory
while
pill is
efficiency
medically
increases.
necessary, the golden
steady
rule is
rhythm
always to
provides
use
structure.
the lowest effective
Each
dose for the
phrase
shortest
connects to the
possible
next,
time.
forming
Now
a
we
continuous
arrive at number
line of
4.
expression.
And this
Even
one
when
will
pauses
absolutely
appear,
surprise
they
you
serve a
because
purpose
it is
within the
heavily
overall
marketed as
flow.
a stomach protector.
Awareness
I am
expands
talking
when
about
attention
proton
remains
pump
present.
inhibitors,
Observing
or
the movement of speech
PPIs.
helps refine
You
articulation
might know them
and
by
balance.
common names like
Sometimes
omeprazole,
progress feels subtle.
pantoprazole, or lansoprazole.
At other times,
these are
improvement
among the
becomes
most
clearly
prescribed
visible.
medications in the
Both
world.
experiences are
Millions
part of the
take them
same
every
process.
morning to manage acid
Momentum
reflux
builds
or
quietly
protect their
before
stomach
becoming
lining from other
noticeable.
medications
Small
like the
changes
pain
accumulate
relievers we
until the
just
difference
discussed.
becomes obvious.
But here is the bitter irony
Balance
that we
remains
must examine
important
from an
throughout the
educational
process. Excess pressure can
the very
disrupt
medication
rhythm,
prescribed
while
to
patience
protect you might be
supports
creating a
stability.
profound danger
Measured
through the
pacing
back door.
encourages
Let
clarity.
me share the story
Each
of
word
Helen.
receives enough space
Helen was
to form
68 and
completely
was
before the
prescribed
next
omeprazole
begins.
for chronic
The
reflux.
motion of speech
Her
involves
doctor
several
told her to take
coordinated
it for
elements.
life.
The
Her
lips-shaped
reflux
sound,
disappeared,
the
so
tongue
she
guides
never questioned it.
articulation, and the
However,
breath supports
years later,
projection.
during a
Together
routine
they
checkup,
create a
her
fluid system of
electrocardiogram
communication.
showed something highly
Consistency
unusual. Her blood
strengthens
work
skill.
revealed the hidden
Repeating
cause.
simple patterns
Her
gradually
magnesium levels
improves
had
control
plummeted
and
dangerously
confidence.
low.
A
You
calm
see,
environment
magnesium
often
acts as
supports
the guardian
better
of your heart
focus.
rhythm.
When
When
distractions
magnesium
decrease,
is depleted,
attention
your heart
returns to the
becomes
present
electrically
moment.
unstable.
Observation
It is exactly
helps
like an
identify
orchestra
areas
trying
for
to play
adjustment.
without a conductor.
Small
Chaos
refinements
ensues,
often
and
produce
dangerous
noticeable
arrhythmias
improvements
emerge.
in
Why
rhythm
does this
and
happen?
clarity.
These stomach
Balanced
protectors
motion
drastically
prevents
reduce
fatigue.
stomach acid,
When effort
but your
remains
body
moderate,
absolutely
movement
needs that
becomes
acidity to
sustainable
absorb
over
vital
longer
nutrients.
periods.
When you
Gradual
suppress
improvement
stomach
often
acid for
feels more
years,
stable
your
than sudden
magnesium
change.
absorption simply
Step by step,
collapses. The
patterns
medical
become
concerns
stronger
do
and
not
more
stop
reliable.
there. Multiple
The rhythm of
observational
speech resembles
studies
the
have
rhythm
found
of
a
movement.
concerning
Both
association
rely on
between
timing,
long-term use of these
coordination,
stomach
and
protectors
balance.
and an increased
Pauses
risk of heart
serve an
attacks.
important purpose.
One theory
They
suggests
allow
these
breathing
drugs
to
reduce
reset and
levels
give
of
the
nitric
mind a moment
oxide
to
in your body.
organize the next
Nitric
phrase.
oxide is a crucial
Over time,
molecule, keeping your
repetition
blood
creates
vessels flexible.
familiarity.
When depleted,
Familiarity
blood
reduces
vessels harden,
hesitation
setting the
and
stage for a
increases confidence.
cardiovascular event.
Subtle variation
Additionally,
maintains
these
interest.
medications can
Even when
interfere with
patterns
vital
repeat,
blood-thinning
small
drugs
differences
given to
keep the flow
patients after a
dynamic.
heart attack,
Calm
making
focus
them
improves
significantly
precision.
less effective.
Each
The
sound
primary
becomes
issue
clearer
is that
when
these
attention
powerful
remains
drugs have
steady.
become trivialized.
Momentum continues
Originally
to build
created
with
for short
consistent effort.
treatments of 4 to
Even
8
brief
weeks,
practice sessions
they have become a
contribute to
permanent
long-term
crutch for
progress.
digestive problems
Balanced
that could often
pacing
be
encourages
managed with
comfort.
simple
When
lifestyle
speech
changes.
flows naturally,
If you take one of
listeners
these stomach
perceive clarity
protectors
and
long
stability.
term, please
Gradual
listen carefully.
refinement improves
Do not
articulation.
stop taking it
Each
abruptly.
repetition
Instead,
strengthens
talk to your
control over
doctor.
sound and
Ask
rhythm.
them directly if you
Observation
really
remains
need
a
this
valuable
medication
tool.
long term.
Paying attention to
Ask if
small
you can
details
reduce the
often
dose
reveals
or find
opportunities
safer
for improvement.
alternatives.
The
If you must
connection
take it
between
chronically,
breath and
it
speech
is
remains
essential that your physician
A steady
monitors
flow
your
of air
magnesium
supports
levels
smooth
periodically.
articulation.
Before we move on to the
Confidence
next danger,
expands
I
as
want to hear from
experience
you.
grows.
I
With
invite you
time,
to think if you have
movement
been
becomes
taking these
easier
stomach
and more
protectors for
fluid.
years without
Patterns
knowing
emerge
these
through
risks.
repetition.
Please share your
Recognizing
experience
these
in the
patterns
comments
allows
below
further
this video.
refinement.
Your
Balance
story could
between
start a
motion and
conversation
pause
that genuinely
maintains
saves a
rhythm.
life.
Both
Let us
elements
continue our
contribute to a
journey through
natural
the medicine
speaking
cabinet
style.
and move
Subtle
to number
adjustments
3.
gradually
This is an
reshape
item
the
almost
overall
everyone
flow.
keeps on hand
Even
during the
small
winter season.
corrections accumulate
We are
into
looking at
meaningful
oral
progress.
decongestants for colds and the
Consistency
flu,
supports
specifically
reliability.
those containing
When patterns
pseudoephedrine
remain
or
stable,
phenylephrine.
results
When you have a
become more
stuffy nose that
predictable.
will not let
Clarity
you rest,
develops through
these pills
attention
seem
and
like a magic
patience.
solution.
Each moment of
However,
practice
from a
strengthens
strictly medical
communication.
standpoint,
Over
that magic
time,
carries
the
an
process
exceptionally
becomes
high
smoother.
cost for your
Effort decreases,
cardiovascular
while
system,
effectiveness
especially if
improves.
you already manage
Momentum
high blood
continues
pressure or
quietly in the
heart disease.
background, building
Consider
strength
Margaret,
through repetition.
a 75-year-old
Awareness
retired
remains the
teacher.
foundation of
When she caught a
improvement.
severe cold,
Observing each
she
step
simply
allows
wanted to breathe
refinement
easier.
to occur
She
naturally.
purchased a very
Balanced
common
motion
over-the-counter
supports steady
decongestant from
progress.
her local pharmacy.
When movement remains
By
relaxed,
the second day of
speech
treatment,
flows without
she
resistance.
felt a terrifying sensation.
Small improvements
Her heart
appear
felt like
again
it was
and again.
bursting out of her chest,
Each one
accompanied
contributes
by
to the
severe
overall
dizziness
direction
and a
of
headache.
growth.
Her son
Gradual
rushed her to the
progress
hospital.
becomes visible with
We
time.
discovered her blood
What once
pressure had
required effort
skyrocketed to
eventually
crisis
becomes
levels,
natural.
and she
The
developed
rhythm
a
of speech
dangerous
continues
cardiac
forward,
arrhythmia.
guided by breath,
That innocent-looking
articulation, and
cold pill
awareness.
pushed her heart
Movement
to the
remains
absolute
calm,
brink.
steady,
To understand
and
exactly
consistent as
why
the
this
process
happens,
continues.
we must look at
A
the
gradual
underlying
shift
science.
often begins
These
with a
active
quiet
ingredients are
moment of
powerful
attention.
vasoconstrictors.
Subtle movement
Their
develops
primary
when
job
awareness
is to narrow the
expands and
swollen
breathing
blood
becomes
vessels in your
steady.
nasal passages
Balanced
to reduce
motion
swelling
forms
and
a
improve
natural
airflow.
rhythm,
The
allowing
critical
each
problem is
phrase
that the
and pause
medication
to
does
flow
not
without
remain
tension
isolated
or
in your nose.
hesitation.
It
Progress progress
through your
rarely
bloodstream,
appears as a sudden
constricting blood
transformation.
vessels throughout your entire
Instead,
body.
it builds
Imagine your
slowly through
circulatory system
repetition
as
and
a garden
observation.
hose.
Small
If you
adjustments
squeeze that hose
influence
tightly,
the overall
the internal
direction of
pressure
movement,
builds up
creating
rapidly.
patterns
Your
that
heart
become
must
more
suddenly
stable
pump
with
against
time.
tremendous systemic
When
resistance,
focus remains
triggering
calm,
dangerous
every
blood
action
pressure
becomes
spikes.
more deliberate.
Furthermore, these
The body
compounds
settles
act as
into a comfortable
stimulants.
posture,
They
and
force your
speech
heart to
begins
beat
to flow with
faster and
clarity.
irregularly,
Words
which
move
can
forward with a
completely
balanced
destabilize
pace,
a sensitive
allowing
aging
each
heart.
sound to
The
form
greatest
naturally.
educational concern
Soft
is that
consonants
these
blend with
powerful
rounded
systemic
vowels.
drugs are sold
Brief
without a
pauses
prescription.
allow the rhythm to
People
reset
buy
before
them
continuing
casually
again.
without reading the
The
warning
motion of the
labels.
lips, the shift
If you
of
are
the
over
jaw,
60,
and the expansion
my
of breath
professional
combine
advice
to
is
create
to
a
avoid
continuous
these
pattern
oral
of
pills.
articulation.
Instead,
Sometimes the
choose
pace
safer
becomes slightly
alternatives like
faster.
saline nasal
At other
sprays,
times, the rhythm
bedroom
slows.
humidifiers,
This
or
variation
localized
keeps movement
corticosteroid
flexible and
sprays that
prevents
do not enter
stiffness.
your general
Balanced
circulation.
motion often produces
Do not let
smoother
temporary
expression.
relief turn into a heart
Observation
emergency.
improves
Always
awareness.
consult your doctor for safe
Awareness
options.
improves control.
Moving forward from the winter
When
cold
each
aisle,
moment
we
receives
arrive at
attention,
number 2 on our
small
countdown.
improvements
This
accumulate
involves a
naturally.
delicate but absolutely
Pressure
vital
often
topic
fades when
encompassing
patience
mental
grows.
health and chronic nerve
Instead
pain.
of forcing progress,
I am talking
a
about an
steady
older
approach
class of
allows each phase
medications
to
known as
develop on its
tricyclic
own.
antidepressants,
Gradual
featuring
expansion
names
often
like
produces stronger
amitriptyline or
results than sudden
imipramine.
change.
Let me introduce you to
Breathing
Frank.
plays an
Frank
important
was
role
78
in
years
maintaining
old
rhythm.
and suffered from
A
terrible
slow
nerve
inhale
pain in his feet
expands
due
the
to
chest,
diabetes.
while a measured
His physician
exhale
prescribed a
supports
low
controlled
dose of
speech.
amitriptyline.
The balance
While it
between breath
effectively
and
helped
voice
soothe his
helps
foot
maintain
pain,
consistent
Frank
pacing.
started
Clear
experiencing severe
articulation
dizziness every
improves
time he stood
understanding.
up.
Rounded
One
vowels
afternoon,
open the
that
mouth,
sudden
while
dizziness
sharper
caused him to
consonants
faint,
briefly close
leading
the
to a
lips before
devastating
releasing
and
sound
painful hip
again.
fracture.
This
The
continuous
hidden
pattern
culprit
forms
was
the
his
foundation
prescription.
of spoken
From an
rhythm.
educational standpoint,
Movement remains
we must
smooth
understand
when
how these
tension is
older
reduced.
drugs impact the
Relaxed posture
cardiovascular
supports
system.
natural flow.
They can
When the
trigger a
body
condition
remains
called
balanced,
orthostatic
speech
hypotension,
follows with
which is
greater
a sudden
stability.
and dangerous drop in blood
Variation
pressure
prevents
when you shift
repetition
from
from
sitting to
becoming
standing.
rigid.
But the risks
Slight
run even
differences in
deeper.
tone,
These
emphasis,
medications
and
can
pace
artificially
create a more
accelerate your
natural
resting heart
sequence of
rate,
sound.
placing constant
Even
and
small
exhausting
adjustments can
stress
change
on an
the
aging
overall
heart
feeling
muscle.
of movement.
Most
Confidence
concerningly,
often
they can
develops
actively
gradually.
interfere with the
With
electrical system of
repetition,
your heart. They
actions
slow
become
down the
familiar
vital electrical
and easier
impulses
to
that keep your
perform.
heart beating in
Over
perfect
time,
rhythm.
effort
This dangerous
decreases,
delay
while
significantly
efficiency
increases the risk of
increases.
severe
A
ventricular
steady rhythm
arrhythmias.
provides structure.
Treating depression and
Each
chronic
phrase
pain is
connects to the
incredibly
next,
important.
forming a continuous
However,
line of
for older
expression.
adults,
Even
these
when
specific
pauses
tricyclic
appear, they serve a
medications are
purpose
generally
within
no
the
longer the
overall
first
flow.
choice because
Awareness
of these cardiac
expands when
risks.
attention
We
remains
now have
present.
newer, much
Observing the
safer
movement of
alternatives.
speech helps
If you
refine
take one of these older
articulation and balance.
medications, you must have a
Sometimes
dialogue with your
progress
doctor.
feels subtle.
Ask if safer
At other
modern
times,
alternatives
improvement
exist for
becomes
your
clearly
specific
visible.
condition. If you
Both
are finding this
experiences
medical
are part of the
information
same
valuable
process.
and want to continue
Momentum
learning
builds
how to
quietly
safely
before
navigate your
becoming
health,
noticeable.
please
Small
take a moment
changes
to like
accumulate
this
until
video
the difference
and
becomes
subscribe to the
obvious.
channel right now.
Balance remains
Finally,
important
we arrive
throughout
at number
the
1
process.
on our countdown.
Excess pressure
This is
can
perhaps
disrupt
the most
rhythm,
controversial
while
and
patience
debated topic
supports
in the medical
stability.
community today.
Measured pacing
I am
encourages
talking about
clarity.
calcium
Each
supplements.
word receives
Yes,
enough
you
space
heard
to
that
form
correctly.
completely before
Those
the next
exact
begins.
pills that
The
millions of
motion
older
speech
adults
involves
take
several
every single
coordinated
day to
elements.
protect their
The
bones
lips
from
shape sound,
osteoporosis.
the tongue guides
For
articulation,
decades, the public
and the
health
breath
message was
supports
clear.
projection.
We were
Together,
told to
they
take
create a
calcium
fluid
for
system
strong
of
bones.
communication.
But from an educational
Consistency
perspective, we must
strengthens
examine
skill.
emerging
Repeating
scientific
simple
concerns
patterns
regarding the
gradually
safety of these
improves
supplements
control
for
and
your heart.
confidence.
Let me tell
A
you
calm
about Linda.
environment often
Linda was
supports
70
better
years old
focus.
and deeply
When
worried about
distractions decrease,
osteoporosis.
attention
Without
returns
consulting
to the
her
present
doctor,
moment.
she started taking a high-dose
Observation
calcium
helps
supplement
identify
every day.
areas for
Years
adjustment.
later, she suffered an
Small
unexpected heart
refinements
attack.
often produce
This was
noticeable
baffling because she
improvements
had
in
no
rhythm
classic
and
risk
clarity.
factors. She did not
Balanced
smoke,
motion
and her
prevents
cholesterol
fatigue.
and blood
When
pressure
effort
were
remains
perfectly normal.
moderate, movement
When
becomes
investigating the
sustainable
cause, her
over
medical
longer
team
periods.
focused heavily on
Gradual
that daily
improvement
concentrated
often feels more
supplement.
stable
The
than sudden
scientific
change.
hypothesis
Step
behind
by
this
step,
risk is deeply
patterns become
concerning.
stronger
When
and
you
more
obtain
reliable.
calcium naturally
The rhythm
from
of
food
speech
sources
resembles
like
the rhythm
dairy
of
or
movement.
green vegetables,
Both
your
rely
body
on
absorbs
timing,
it slowly and
coordination,
efficiently.
and
However,
balance.
when you take a
Pauses
highly
serve an
concentrated pill, it
important
creates a
purpose.
massive
They
artificial
allow
spike of
breathing to
calcium in
reset
your
and give the
bloodstream.
mind a
Your
moment
body
to
simply
organize
cannot
the next
use all that
phrase.
sudden calcium for
Over
your bones.
time,
The
repetition
primary
creates
medical concern
familiarity.
is that this excess
Familiarity
calcium has to go
reduces
somewhere,
hesitation
and it often
increases
deposits
confidence.
directly into your artery
Subtle
wall.
variation
This
maintains
dangerous
interest.
process is
Even
known
when
as
patterns
arterial
repeat, small
calcification.
differences
It
keep the
makes
flow
your flexible
dynamic.
arteries completely
Calm
rigid
focus
and
improves
contributes heavily
precision.
to forming the
Each
plaques that
sound
trigger
becomes
heart
clearer
attacks.
when
The
attention
medical
remains
evidence
steady.
remains complex,
Momentum
but the
continues to
educational
build
lesson
with
is perfectly
consistent
clear.
effort. Even
More
brief
is
practice
absolutely
sessions
not
contribute
better.
to long-term
The safest
progress.
and most effective
Balanced
strategy is
pacing
always
encourages
getting your
comfort.
calcium
When
from a
speech
balanced
flows
diet.
naturally,
If you
listeners
believe you need a
perceive clarity
supplement,
and stability.
never start taking it on
Gradual
your own.
refinement improves improves
must be a
articulation.
careful medical
Each
decision made with your
repetition
physician
strengthens
weighing your
control
bone
over
health
sound
against
and
your
rhythm.
cardiovascular
Observation
risks.
remains.
Today we have uncovered the hidden side of 5 common medications. We discussed the heavy burden of anti-inflammatories, the unexpected rhythm dangers of gastric protectors, the intense pressure spikes from oral decongestants, the electrical interference of older antidepressants, and the arterial risks of highly concentrated calcium supplements. My main message to you today is absolutely not panic. I am not telling you to go to your bathroom cabinet and throw your pill bottles in the trash. Stopping any prescribed medication on your own without professional supervision is extremely dangerous and could trigger a medical crisis. Instead, my message is pure empowerment. Now you possess valuable, life-saving information that most people simply ignore. Use this educational knowledge to become an active partner in your healthcare. The next time you visit your physician, you must go prepared. Take a complete list of everything you are taking, including over-the-counter pills and vitamins. Ask your doctor clear and direct questions. Say to them, "Doctor, I understand this medication could carry hidden risks for my aging heart. Is it still the absolute best option for me? Or are there safer modern alternatives we can explore? Should we monitor my blood pressure while I take this?"
This might get
Remember
a
that
little
every
tight
medical
now.
treatment is a
That's
delicate
fine.
balance
Your
between
blood
benefits
pressure
and
looks
risks,
great,
and that
right in the
balance
healthy
naturally
range.
changes as your body ages. Your heart has worked incredibly hard for you over the decades. It deserves exquisite care. Protecting it by asking the right questions is the greatest investment you can make in your future. If you found this educational video helpful, please like this video and subscribe to the channel right now. I also want to hear from you. Share your own experiences in the comments below. Did any of these medications surprise you? Your story might be exactly what someone else needs to read today. Take care of your heart.